But because it's urine, you take those same hormones you would get in blood or saliva, and you get the pathways because they've gone through the pathways. They've gone through the liver and they come out into the kidney. And so we get this bigger picture, this bigger snapshot of all your hormones. Plus, are they going down the good pathway? Or are they going down the bad pathway?
Welcome to the Rebel Health Coach Podcast with Tom Underwood. Armed with truth and knowledge, your journey to a healthy lifestyle can be obtained. Preventative wellness, quality nourishment, and daily fitness routines dramatically improve your outlook on life as a whole. And you'll find the support and info you need to accomplish a healthier lifestyle here. Together, we can empower each other along our journey to an amazing you.
Today on the Rebel Health Coach Podcast, I have Dr. Carrie Jones. Dr. Carrie Jones is an internationally recognized speaker, consultant, and educator on the topic of women's health and hormones. She graduated from the National University of Natural Medicine, School of Naturopathic Medicine in Portland, Oregon, where she also completed her 2-year residency in women's health, hormones, and endocrinology. Later, she graduated from Grand Canyon University's Master of Public Health program with a goal of doing more international education. She was adjunct faculty for many years at the National University of Natural Medicine, teaching gynecology and advanced endocrinology fertility, and has been the medical director for 2 large integrative clinics in Portland. She is the medical director for Precision Analytical Incorporated, creators of the Dutch hormone test. Today on the Rebel Health Coach Podcast, I have with me Dr. Carrie Jones, who is a naturopathic doctor, and she is now currently the medical director at Precision Analytical. And today we are going to discuss the Dutch test and hormones. Dr. Jones, welcome to my show.
Thank you. I was super excited when you reached out. So
I was super excited you responded. I was like, oh, I'm yay. And then you just had a vacation, or it was at a conference in Hawaii.
It was a combination. Yeah, it was. It's called Hawaii Doc Talks, and it's put on by doctors, and they rotate islands every year. And so I was there for 4 days for that, and then I stayed extra for vacation.
Oh, good. Good for you. And I know you're on the West Coast. Why don't you tell the listeners who Dr. Carrie Jones is?
Who is Dr. Carrie Jones? Well, I joke all the time that women's health and hormones is the only thing that I know. That's what I do. So you were saying earlier that your expertise in like men's health and diabetes and cardiovascular, that's not my area. But if you are a female and you have hormone issues and, you're not quite feeling yourself, that's what I've been doing for the last 13 years. I did my residency in it. I focused in it in medical school. I got my master's in public health and focused in women's health, international women's health stuff. And then just kept going down that track. Here I am.
And how long have you been with Precision Analytical?
I have been with them, I want to say 5 years, but I have not been paid formally all 5 years. I volunteered a lot of help for them in the beginning. When they first started, the owner approached me at my clinic and said, hey, would you consider trying this test on your patients? And I said, yeah, sure. I know who he was. His name is Mark Newman. He'd worked for other lab companies, other functional lab companies. So I had been following his career. I said, yeah, sure. I think you're amazing. So I'll try your test out. And then he started using me to bounce ideas off of, and I started doing writing for him. And then it morphed into, I got a paycheck, and then I was part-time with him and now full-time. And I've been the medical director, I want to say about 2 years, 2.5 years. Okay. Yeah.
And now do you still have a practice on top of that?
I do not. So I gave up a very busy practice probably about 2 years ago when I became the medical director. I loved practice. I absolutely loved my patients. I had great, funny, down-to-earth, fantastic patients. It was just too much. I do a lot of travel with this job and a lot of education. I have a team of 6 that work for me. I have 5 doctors that work for me, and we have a support specialist. And
wow.
So I had to give. So I had to put practice on hold for a little bit.
Well, let's start out with, what is a Dutch test?
What is the Dutch test? And it's funny that you had written on the first form that you sent to me, is it testing Dutch heritage? Because man, we get asked that often. Are you a genetic test? I'm not Dutch. Do I need to do your test?
Right.
Like, it's an acronym. It stands for Dried Urine Test for comprehensive hormones. And comprehensive being the operative word, it's basically these little pieces of filter paper that people urinate on throughout the day, let dry, mail in, and we give them a comprehensive overview of all their hormones and their hormone pathways.
I've got my test right here.
Oh, good.
Which is very interesting in itself. So why should somebody test their hormone?
I always say, and this is not because I work for a hormone or a test company, but I always say test, don't guess. And what happens is people are like, I don't feel good, right? I'm fatigued. I have PMS. I can't get pregnant. I have menopausal symptoms. I have brain fog. Men have the same complaints. Men say, I'm gaining weight. I'm fatigued. I have no motivation. I can't recover as well as I used to. What's going on? And so instead of just throwing supplements and vitamins and nutrients and dietary changes at them, which are important, but I say, well, let's test. Let's test and see what your hormones look like. What are your adrenals doing? What are your gonads doing? What are your ovaries doing? And then what pathways are they going down? And let's see if we can help this.
This test, as you said, is a urine test.
Yes.
And there are serum tests for this. There's also saliva test, but saliva test can be affected by a lot of different things. So you get, I think it's 5 strips.
You can. So there's 4 main strips you do in the day. So first thing in the morning, 2 hours later, around dinner, and before bed. And then if you wake up in the middle of the night, because insomnia is so common, then you collect that 5th strip. So if you wake up at 2 a.m. and you have to pee, you get up, pee on the strip. And then we'll tell you your cortisol at that time.
When you collect these, you have to let them dry and then send them back in an envelope.
Yes.
Because I had mine all over my countertop.
Yep.
It was kind of unique.
Yeah.
Good thing I live by myself, because I don't think a significant other would like, why is your pee strips on the countertop?
The other thing, we have a lot of parents that say, I did the test, but my kid ran off with a strip, or the dog, they'll say their dog jumped up. And I to warn people, check your strips.
Yeah. All right. So what are the drawbacks of serum testing and saliva testing?
Well, serum, I'd say the number one thing is people are afraid of needles. And then with saliva, just right off the bat, a lot of people can't produce enough saliva to fill up a tube, right? It's hard to freeze spit into a tube 4 times during the day. So collection right there can be really challenging. But serum and saliva they give you the snapshot of what's going through your body at that time, which is great, of course. Like, there's your estrogen, there's your testosterone, there's your DHEAS, there's your cortisol, but it doesn't give you patterns and pathways, meaning you can get your blood drawn 4 times in the day. It's a big giant pain. So if you want to know what your cortisol is doing throughout the day, you have to do multiple collections. That's why saliva was created in part. And now with urine, you can do the same thing, collect multiple times in the day. But because it's urine, you take those same hormones you would get in blood or saliva, and you get the pathways, because they've gone through the pathways. They've gone through the liver and they come out into the kidney. And so we get this bigger picture, this bigger snapshot of all your hormones. Plus, are they going down the good pathway? Are they going down the bad pathway? What's going on? And by bad, I don't necessarily mean like cancer per se, but it might be. But It might just be even the pathway that causes acne, or the pathway that causes, anger and irritation, or the pathway that causes, hair loss on your head. And so these are important things that people want to know. It's the symptoms they have.
So let's dig in there a little bit. What's actually measured? What are we measuring in the Dutch test?
What are we measuring? So we're measuring all your standard hormones. We measure for male and female. They're the same, just different levels. So we measure all 3 of your estrogens, your E1, your E2, and your E3. We measure progesterone, which we even measure that in men. And actually in urine, we measure what's called progesterone metabolites. So progesterone is not very well found in urine, but it has two what are called metabolites that very well represent progesterone, like in blood, or progesterone in saliva. And it's actually really helpful to know those progesterone metabolites. One of the metabolites, just as a side note, the alpha metabolite, it's the one that when it's increased, it helps with insomnia and it helps with anxiety. And so you have all these women that say, when I'm losing out on progesterone, when I've stopped ovulating, maybe she's heading into menopause, she goes, I can't sleep like I used to, and I have worse anxiety. I'm like, oh yeah, because this one metabolite of progesterone, this alpha metabolite, you're missing out on it, and it's part of the picture. So it's kind of neat to see that when you're looking at hormones. But then we also look at testosterone, and we look at DHEAS, and we look at those are called androgens. Those are in the androgen family, and we look at the breakdown of those androgens. So there's 4 other hormones for that we look at. Okay. They have big fancy names. I don't know who names them, but they're androsterone, etiocalanolone, and then 5-alpha and 5-beta androstenediol. And then, of course, we look at DHT, which we hear a lot about DHT with like men in the prostate and even for women. Think of like your PCOS, your PCOS picture, right? The acne, the facial hair, the hair loss on their head. So we look at that too.
Okay.
And then on top of that, we look at what's called your estrogen metabolism. So we tell you, how is your estrogen getting detoxed in your liver? Do you go down the good pathway, the bad pathway? And then do you go through phase 2? So there's phase 1 and phase 2. We look at both of those. And then we look at melatonin, great for people who can't sleep. And then we look at a lot of cortisol markers. And then we look at some nutritional and some neurotransmitter metabolites. So we look at B12 and B6 and glutathione. And we look at a dopamine metabolite, so brain hormone. And we look at norepinephrine and epinephrine metabolite. And we look at serotonin metabolite.
Okay.
And so it's a lot, right? It's a lot that you can get out of your urine. And it all gives you sort of that big picture of, why am I tired? Why am I depressed? Why can't I sleep? Why can't I lose weight? All in 6 pages.
Right. It's an in-depth. It's a very in-depth test.
Yeah, and all you have to do is pee on a piece of filter paper 4 times in the day.
But you reach this, right? Exactly. It's really simple. No blood draws, no saliva. You don't have to spit in a tube, like you said, to your point. And it gives you a whole panel of stuff. But you recently added another test onto the Dutch Test Complete. You added the OAT test.
Yeah. So those, we call them Dutch extras. So we've always had melatonin, and about, I don't know, sometime last year, 9 months ago, we added what's called a DNA damage marker called 8-OHDG. It's a marker for oxidative stress. Okay. And then on top of that, in January of this year, January 2018, we added on those 3 nutritional markers, so B12, B6, and glutathione. And those all tie into the Dutch test. They all tie into hormones, right? B6 and B12 have a lot to do with estrogen detox and energy and the adrenals and brain production and all this good stuff. Glutathione, your most potent antioxidant in the body. So we have one marker for it. We don't have all the markers, but we have one of them. And then we have the neurotransmitter metabolites. So dopamine, which is called HVA. And then norepinephrine and epinephrine, which is called VMA. And then serotonin, which is shortened to 5-HIAA. So we take a even bigger picture look to see what's going on.
Yeah, mine doesn't have that test on there.
You had to have done it by January 2nd when we added them.
Yeah, I got this in December, so I didn't get those added, but I'm going to redo it because I've been working on some of my oxidative stress levels and see how it comes back the second time around. Why is it important for people to measure their cortisol levels, their cortisol production, and their adrenal glands?
Because I think in this day and age, and I'm sure you'd agree, I mean, people are just under a tremendous amount of stress from their life, from the environment, from their food, from all over. And so knowing how your hypothalamic pituitary adrenal axis, your HPA axis, is functioning is really important for a lot of people. And I think people don't quite realize the amount of stuff cortisol does in your body. You know, cortisol's primary job is blood sugar regulation. It's the cortisol is called a glucocorticosteroid. And gluco, because of glucose, cortico, it's made in the cortex of the adrenals, and steroid because steroid hormone. So I tell people, if your cortisol is a mess, you more than likely your blood sugar is going to be a mess too. And so, that's just one of the many things it does. Cortisol helps fight infection, and it helps reduce autoimmune risk. And it helps with rhythms in the body, even reproductive rhythms like menstrual cycles. And it does a lot. And it helps with energy. How many people report being burnt out, stressed out, tired? And then on the flip side, if you've got too much of it, now you're in fight or flight, and you have anxiety, and you can't sleep, and you have panic attacks. And so it's good to know a lot about your cortisol. Yeah.
Because you want to know where you stand. If I know quite a few people that I see their posts on Facebook in the morning saying, I didn't sleep at all last night.
Right.
And it's like, okay, what's going on? You know?
Exactly. And as you know, it can be a lot of things. It can be, cortisol driven. It can be melatonin driven. It can be adrenaline driven. And if you don't know, then you're just going to be trying supplements, and maybe they work, and maybe they don't. You've just spent a bunch of money. And you're like, oh, this stuff doesn't work. But yeah, you were just going down the wrong rabbit hole.
Right. There's a lot of rabbit holes there.
There's a lot of rabbit holes.
I'm like one of those people that go down the rabbit holes quickly. So it's a good thing. I like to investigate things. So it's a good thing. Let's talk a little bit about why it's important to measure our metabolites.
Yeah, actually, my most favorite example is estrogen, when looking at the estrogen metabolites. So as I was saying earlier, men and women make estrogen. And then once the body's done with it, it has to go somewhere. So it pushes it through detoxification. And we have two phases, primarily, phase 1 and phase 2. Some people say phase 3 is then the actual ability to get it out of the body. So we look at that. We look at those estrogen metabolites in phase 1 detox, and I can say, hey, look, I think you're going down the pathway that maybe can cause cancer if not dealt with. Or I can say, oh, this is working. You're going down the right pathway. This is good. Nice job. And then taking it one step further, we then say, all right, now can your body completely neutralize it and put it through phase 2 detox? And we look at that. So just knowing your estrogen alone isn't enough. You think of how many men and women go, I'm estrogen dominant. I have estrogen dominant symptoms. I have PMS or heavy periods or tender breasts, or men say I'm gaining weight and I feel depressed and unmotivated. That can all be estrogen. But if you just look at estrogen, you're only looking at a very small part of the pie. You still have to see, like, maybe your estrogen levels are totally normal. But the problem is you can't detox it out of the body. So it just floats and floats and floats around again. And so you need to address that.
One thing a lot of people throw at this is DIM.
Everybody throws DIM at it.
It's like, really?
Drives me nuts.
Yeah, me too. It's like, I bought some DIM and I'm like, oh, that's great. Well, do you know what it does? It's just, I want to scream when...
And when DIM works, for your listeners, if they don't know, DIM is diindolylmethane. It's one of the constituents of the broccoli, kale, cauliflower family. But it only works on phase 1 detox. That's where it specializes. And so if you don't have a phase 1 problem, or let's pretend you have a phase 1 and a phase 2 problem, then DIM actually might make the situation worse. And people don't realize that. Okay. Because my analogy is a bathtub. So phase 1 is the water coming into the bathtub. How much water? How fast is it? Which kind of water is it? Is it the good kind? Is it the cancerous kind? And then phase 2 is the ability of your drain. So DIM affects the water in phase 1 of your detox. But if your drain is shut, then you can take all the DIM in the world. It doesn't matter. You have to open up your drain. Otherwise, you can just make things worse.
Right. To sign up for my monthly newsletter, text RHCP, that's Rebel Health Coach Podcast, or Red Hot Chili Peppers, to 22828. Again, that's RHCP to 22828. Thank you and have an awesome day. All right, now I'm looking at my metabolism pathway here.
Okay.
My 4-OH is high.
Uh-oh.
Yeah. That's what I said.
Well, What's your 2OH?
My 2OH was 81.3 and 4OH was 14.3 and 16OH was 4.3.
How's your phase 2 looking? In the lower left-hand corner is that little fan gauge facing low or high?
Low.
Ooh.
Yeah.
So you unfortunately fit into my analogy. So you have the wrong water coming into your bathtub, and then your drain is slow.
So I got some work to do.
You got some work to do.
And where does glutathione play a role in that?
That's a great question. So glutathione plays a role. So if you're on the Dutch test, but just in general, when you're thinking of a steroid pathway, so 4OH, if it doesn't go through phase 2, if it doesn't get methylated, which is phase 2, then it turns tail and it goes down a different pathway. It's called the quinone pathway with a Q. And your body has 2 stop gaps on that quinone pathway. One is the enzyme quinone reductase made by the quinone reductase SNP. And the other stopgap is your GST enzyme made by the GST SNP, which is glutathione sulfur transferase. So if you have 4OH going down that naughty pathway, glutathione is one of your preventive measures to get it to stop and get rid of it safely. And that's where glutathione works.
Right. And that's what I've added.
Yes. The other one that will affect GST, but is sulforaphane. Are you a fan of sulforaphane? That's the active ingredient in broccoli sprouts, and it works really well with quinone reductase. So it works with the other stopgap, although it does affect glutathione. It is helpful to glutathione.
Okay.
So instead of DIM, which people would say, well, I eat broccoli, it's actually the sprouts that have the highest amount.
And I do eat a lot of broccoli, so I'm working on that too. So
perfect.
That's why I said I'm going to redo the test here after I do some playing around with my body because I'm a guinea pig.
Your own lab rat?
Yeah, I am a lab rat.
Me too.
I'm my own lab rat.
I just did we have another test called the cycle map test, which is where women collect almost every day of their cycle. And the lab graphs it out and tells you what your estrogen and progesterone are doing just about every day. And so I just lab ratted myself on that.
I think I saw that on Instagram.
Yeah, I put that on Instagram.
Yeah.
It wasn't great. I got some work to do.
And you even admitted it on Instagram.
Oh, completely. Yeah. Yeah, it was funny. I joke. I was like, I was having a lot of hormonal symptoms. Enough that I was complaining about them.
Right.
And I thought, wait a minute. I work for a hormone company. Like, I can do something about this.
Oh, that's funny. All right. What is the difference between this DHEA and DHEA sulfate?
So they're not the same thing. And everybody thinks DHEA and DHEAS are the same thing. So DHEA is made first, and it's made in the adrenal glands primarily, although some of it is made in the gonads or in the ovaries, but primarily it's made in the adrenals. And then the body converts it on. So if it is in sort of a holding pattern, it sulfates it, which puts it as DHEAS. Okay. Now, DHEAS does not have a circadian rhythm, but DHEA does. It's highest in the morning, lowest at night. And if the body can't sulfate, if you have a sulfation problem, then DHEA moves downstream and becomes other things, like something called androstenedione. And then androstenedione converts into other things. It converts into testosterone. It converts into those 2 metabolites I said earlier, etiocalanolone, androsterone. And so a lot of people just focus on DHEAS because it's a good indicator of how much maybe DHEA is in the body. It's not 100% good indicator. It's a much smaller percent good indicator, if that makes sense, because DHEA can make other things like androstenedione. So you have to look kind of at all those metabolites to see, well, where exactly is DHEA, no S, going? Is it going to S? Is it going to androstenedione and then continuing on down? And so it's important to know that. And one of the big reasons that I don't think people realize is inflammation lowers sulfation. And so if you just look at DHEAS, if you just got a blood draw or you just got your saliva test done and you look at your DHEAS and it's low, you might think, oh, I need to take DHEA. But really, if you're a very inflamed person, like you have, gut issues, let's say, or diet issues or something, then you may actually make normal amounts of DHEA, no S, but it can't put the S on because the inflammation gets in the way. And so it just moves downstream. It just keeps going and bypasses the DHEA S completely. So what's cool about the Dutch test is you see all these markers. So you can say, okay, my DHEA is getting divided up evenly, or, oh no, it's going down this one pathway preferentially, and that's where it's going.
And what would cause somebody's DHEAS to be very high?
Well, the big one, of course, in women, we think of PCOS.
Okay.
So insulin problems is a big one. Any supplementation. So a lot of people do, oral or sublingual DHEA. That'll drive it up quite high. Certain medications, believe it or not, Wellbutrin, which is an antidepressant medication.
Right.
Xanax, which is an anti-anxiety, also known as alprazolam. And then certain ADD medications like Ritalin. Ritalin can drive up DHEA. And then alcohol. Alcohol can affect DHEA. In fact, I think I was just reading a study. Alcohol can raise DHEA something like close to 20%, 17%.
Wow.
From regular moderate use of alcohol. And we see this, and obviously not every single person, but I have had plenty of practitioners that say, oh, this patient drinks a bottle of wine a night. Like, that's probably doing it. Like, well, a bottle of wine a night coupled with insulin problems, for sure. Or they're on Wellbutrin, or they're on Wellbutrin and Ritalin. And like, well, it's medication induced. But then the last big thing is stress. DHEA is very protective in the brain against the effects of cortisol. So if you've high levels of cortisol, high stress, then DHEA can go up to counter it to prevent the damage in the brain.
Okay.
So sometimes I want DHEA high. Sometimes in a very stressful situation, and maybe somebody gets their test drawn or done, I'll say, it's okay. Let's just leave it. Your stress is a 10 out of 10. Like, let's protect your brain.
Right. So why does Dutch combine metabolites with DHEAS for total DHEA?
It's for that reason, because we don't test DHEA, no S.
Okay.
But we look at all the pathways it could go down, and then we add that together and say what it's kind of a total DHEA potential.
Okay.
I guess maybe a better word for it. So can you even make DHEA? Because if you just look at the S and it's low, you might think, oh, I don't make DHEA. But you have to look at everything else to go, oh no, I actually do make it. It's just going down other pathways.
Okay.
Yeah.
All right, let's go to cortisol.
Yeah. How's yours? He laughs.
Yeah. Yep, I'm going to laugh. Let me find it. Actually, my cortisol wasn't bad. A little high in the afternoon. And I think I can, what I figured was that was because of, I work out at 9 a.m. and I do a very intense workout. So I think that's where I get that zip up.
Yeah.
And then a little afternoon crash. My cortisol.
Do you notice that afternoon?
I do. No, I used to.
Okay.
And since I've been taking the glutathione, I haven't noticed it.
Oh, that's great. That's very cool.
Plus, I've added a quarter teaspoon of baking soda to my regimen 3 times a day.
Are you liking that?
And that's helped out balance that. I haven't been getting that crash.
Nice.
Yeah.
Nice. That's fantastic.
Like I said, I'm my own lab rat.
And the thing with cortisol is, it changes by the second. And so getting testing done is fantastic because, I tell people, hey, when you test your cortisol, do it on a typical day. Don't do it on a weekend. Don't do it on vacation. Don't do it when you're relaxed. If Monday through Friday are basically about the same, roughly, the same amount of stress, the same amount of things, that's when you should do it, because your afternoon point in December when you did this is, and if you work out every day at 9 a.m., like you probably look like that most days of the week, right? And so it gives you a good snapshot of like, all right, here's where I'm at sort of on my day to day, and then what we need to do.
Right. One thing I noticed though is my melatonin waking was 3,179.
Do you take melatonin?
Yes.
Yeah, that's why. So first of all, I'll say we do collect our melatonin off the waking point, but it doesn't mean we're not collecting your actual literal waking melatonin, because what happens is you gather melatonin in your bladder all through the night. Okay. And when you wake up first thing to pee on the strip, all the melatonin that's been collected through the night shows up on the waking point. So it's not like a blood draw. If you've got your blood drawn, it's that moment.
Right.
Ours is a delayed response.
Okay.
Urine, because it sits in the bladder. But our test is only a baseline for melatonin. And melatonin, of course, goes through first pass in the gut and the liver, and then it explodes into a ton of metabolites. It doesn't mean you're taking too much melatonin. It just means your body is effectively clearing. I've seen it up to like 10, 12,000.
Wow.
You don't have to worry. You don't have to worry at 3,000. Okay. It just means you're on it.
Okay. The difference between free and total cortisol.
Yeah, and this is a big one. This is a big concept for a lot of people, myself included, 5 years ago. Just like any other hormone, I mean, your body, you make cortisol, and then only a very small fraction is free, right? Only like less than 5% of any hormone is free. Hormones are like children. Your body doesn't leave them unattended at any time. It binds them up and puts them other places so they can't like wreak havoc. And so cortisol is the same way. You have all this cortisol that was made, but only a very tiny percent is free. And so we report what's called total cortisol or metabolized cortisol, which is your cortisol potential. That's how much you made in total. And then the very teeny tiny percent that's free, we report that as well. Now it's the free that does stuff. It's the free cortisol that like deals with your stress and deals with your blood sugar and, deals with your crashes or your causes insomnia. But we still need to know, is your free cortisol because you don't have it? Or is it actually the opposite? You actually make tons of cortisol, just your body is not allowing very much to be free and available. And so it gives us that bigger cortisol picture.
Why would you think maybe your cortisol is normal when it's actually quite low?
Well, one of the big reasons is that it could be converting to cortisone, which is inactive. So we test cortisone, and people often confuse cortisol and cortisone. They think cortisone because they see on the grocery store, they'll see like, hydrocortisone cream. Well, hydrocortisone is actually, it's terrible naming. Hydrocortisone is cortisol. It's cortisone that gets hydrolyzed. It becomes cortisol. So it's just a fancy, stupid pharmaceutical name. But cortisone, no hydro, just cortisone on our test is inactive. It's inert. And the body will convert back and forth between cortisol and cortisone depending on the need, depending on the gland, depending on the tissue, what's going on. And so a person may be making plenty of cortisol and the body's going, wow, this is a lot of cortisol. I don't like this. And it will deactivate all of it for the most part to cortisone. And so you may just maybe you did a saliva test and you see all this low free cortisol and you think, oh my gosh, I have to go on all these adrenal supplements and I need to, stimulate cortisol. And then you look at your cortisone on the Dutch test and go, oh, I'm just deactivating. That's different treatment altogether. My gland makes cortisol. It's just getting deactivated. Right. And the two most common reasons that we see over and over is one is just after acute illness. So think about when you have the flu. Like I just had the flu. I thought I'd missed the flu. I was so happy. I hit March, didn't get the flu. Everyone's getting the flu, and then I got the flu. But when you get the flu and you're really sick, but then you get over all the symptoms, except for like a week or two, you're still tired, or you're still kind of coughing, you're still like run down. One of the reasons is the body will push your cortisol to cortisone. It's a healing mechanism. Okay. And then the other big reason we see often is with long-term stress, where the body's had enough, where the body's like, I don't want to make all this, I don't need all this cortisol hammering my tissues all the time. I'm going to convert it to cortisone. And so sometimes I can look at the Dutch test and say to people, hey, I think your body's trying to tell you to slow down. And it's amazing the number of times people go, yeah, I know. But they don't. They just keep burning the candle at both ends.
Right. I mean, I think because a lot of people work a lot of hours these days. And I think that's a big thing.
And we're always connected, right? Yeah, like we were talking about social media and Instagram, and we're always connected. We're always on. We're always going and doing, hustling. And the body has to keep up on top of doing all the other stuff the body's supposed to be doing, like protecting us and healing us. And
I always say God gave us an amazing body inside that's supposed to be working properly, but we screw it up.
Right, exactly. We do screw it up.
Right.
Unfortunately.
All right. What type of hidden infections in your gut or blood can cause high cortisol?
Any infection, because cortisol is anti-inflammatory to a point.
Okay.
And so when it can be hidden infection, overt infection, doesn't matter. And we see it a lot. Everything from, candida or SIBO or, gram-negative bacterias, worms, gram-positive bacteria, it doesn't matter. We see it all the time. And sometimes people don't even realize it. They don't realize they have a gut infection, but they have this perpetually high cortisol. I'm like, man, you really need to go get GI testing. Let's see.
Right. See what's going on in your stool.
Yep.
Test, don't guess.
Exactly. Poop in a cup for science, people.
Right. Exactly. I mean, I get questions a lot. Like people are like, well, what do you think's wrong? And I'm like, well, there could be a multitude of problems. Let's run some tests and see.
Yeah. Yeah. Unfortunately, humans do not come with a manual or instruction manual, right? Like my car. I have no idea what's going on with you.
This came from a listener. Being as so many women self-medicate with estriol creams, can it be reliably measured in urine?
Yes. So we do something that's called a split. So when somebody uses vaginal estriol cream, and for people listening, it's commonly used for vaginal dryness. Estriol is the third estrogen, E3. It's the estrogen of choice by the tissues in the vagina. And so when women are on that, they can absolutely do urine testing. We can tell the difference between cream and not cream.
Okay.
On our test. So absolutely. But I will tell women, be careful, because the tissues in the vagina are what's called a mucous membrane, and they suck up hormone way better than other skin in your body. So for example, women who put cream on like their arm, let's say their inner arm, that tissue is different than the vaginal tissue. So they may find they don't actually need quite as much hormone in their vagina that they thought they did, because that tissue sucks it up. It loves it.
Okay.
And so just FYI to women, mucous membranes, especially down there, utilize it quite well.
That's interesting.
Yeah.
All right. What mistakes do you see most often by practitioners in the field that use the Dutch test?
I'd say a big mistake is timing. Men and menopausal women can test at any time. And I would say this is true for any hormone test. I've talked to colleagues of mine who work for other hormone companies, but women who are still cycling, the ideal time to test is in the luteal or luteal phase. So roughly days 19, 20, 21 of a 28-day cycle. And it's amazing the number of times practitioners just hand their patient a test and say, we'll just go collect. And they'll collect on day 1 of their period or day 7 or day 12. But the reason we want it in that luteal or the second half of their cycle is that's when progesterone comes out to play, hopefully. So we want to test that. If you collect in the first part of your cycle, you should have very, very low progesterone. That's normal. And so we want to collect in the second half. The other mistake we see a lot of people who test on the birth control pill, it's not so much a mistake, is that I just want people to remember that if the birth control pill is working, it will shut down your own endogenous hormone production. And then your estrogen and your progesterone are generally very low, and that's normal. It means the pill is working. I'm not saying it's healthy. I am just saying it's the mechanism of action of the pill. And so if you have somebody on the pill, which is common, and a lot of women are on the pill, just when you hormone test, expect to see very low levels.
Okay.
So I'd say like timing is the big one that would be the mistake that happens a lot.
Interesting. So timing and day, what did you say? Days 19?
19, 20, 21-ish of a 28-day cycle. So then people ask, well, my patient has a 35-day cycle. I'm like, all right, we'll move it up to more like days 23, 24. Or they'll say, well, my patient has a 25-day cycle. I'm like, all right, we'll move it down. Do it at like, day 16, 17.
Okay.
That's fine. Yeah.
All right. Now this one comes from a fellow classmate. 5-alpha reductase question for you.
Yes.
Most of the recommendations for helping reduce and inhibit 5-alpha reductase are also not recommended for women who are wanting to have children. Examples are saw palmetto, EGCG, which is a polyphenol from green tea. What would you recommend for a woman who is wanting to conceive or reduce PCOS?
So I actually do use those 5-alpha reductase. I use saw palmetto. So the list is saw palmetto. It's stinging nettle root, pygeum, which is Pygeum africanum.
Okay.
EGCG, like you said, is in green tea. Reishi mushroom and zinc. Those are all in the, we call them, quote, 5-alpha blockers, so to speak. And so I will use, if somebody is actively trying to conceive, I will still use them. And I'll just say, when you have a positive pregnancy test, you have to stop them. You can't, on the other, except for zinc, they can stay on zinc. But I still use them when they're trying to conceive. I just have them stop with a positive pregnancy test.
Now, stinging nettles are used for a lot of things.
Stinging nettle, you can differentiate between leaf and root. So leaf is the diuretic. Okay. And root is the 5-alpha blocker, quote unquote blocker. So yeah. And if some people are concerned, then I may stick with just zinc and reishi mushroom, things that are a little more, like reishis could be more, medicinal for food-based, you could say. But yeah, I still use them. I still use them on women trying to conceive, PCOS women. I just have to stop. I mean, it's the same for a lot of the herbs I use in general, or adrenal herbs, ovulation herbs. They're not tested for pregnant women, and so I just say stay on them until you get a positive test, and then stop them. I also don't use herbs like mistletoe, or certain herbs that are very concerning maybe for someone trying to get pregnant. I stick to well-known herbs.
Right. Okay. Yeah, I've never heard mistletoe. What is that? What do you use that for?
I don't, but I know I have colleagues that use it in cases of cancer. They'll use it in cancer treatments.
Okay. All right. The next part of this question: if the 5-alpha path is more managed, is there a risk that cortisol will then become high?
Not so much high. So 5-alpha reductase does break down cortisol. I will say that for all the people, the thousands of tests I've seen of people on, let's say, saw palmetto or stinging nettle root, I have not seen their cortisol go crazy as a result.
Okay.
Yep. I cannot make that correlation.
Okay.
In theory, it should affect it because it's 5-alpha reductase, but I have not seen it go crazy.
Okay.
Which is entirely possible because the person is usually also on some sort of HPA axis support as well. So they're getting double support. They're getting the adrenal support and they're getting the 5-alpha for the androgen support. And maybe that's why.
Okay.
But I don't see cortisol go crazy.
No.
With saw palmetto or zinc or EGCG.
Okay.
Yeah.
All right. As we discussed earlier in this episode, that the oat test was recently added. Are there any plans for future testing to be added to?
Yes. Oh my gosh. We have a lot of things going on in our little science laboratory. So stay tuned. Unfortunately, I'm not allowed to mention any of them, but we do have some other oats that we are looking at. We have been, polling, kind of informally polling practitioners for the last couple of months, asking, your wish list, what else would you want on an oat test?
Right.
And so some things we can do with the technology that we have in the lab, and other things we just don't own those machines and we can't do them. But we are looking at adding other oats and doing some other cool stuff, adding some other cool testing. So stay tuned.
Okay, cool. Well, let's explain for the listeners that oats is organic acid testing.
Yes, organic acid test.
It's not like oatmeal.
Oh, right. I know. It's another one of those funny acronyms.
Right.
Dutch and oat, right?
We're not testing your oatmeal levels.
Not oatmeal. Right.
All right. Last question for you. I asked all my listeners is, if you had like an hour to just chill, what artist or album would you listen to?
Well, I was totally chilling out right before I was on here. Actually, I should say I was rocking out. I was listening to the CCR channel on Pandora. So.
Oh, wow.
I don't know that it's like chill out, but that definitely put me in a really super good mood before I dialed into this. So.
Well, I have to say, it seems like you're always in a pretty good mood.
I am always in a pretty good mood. Yeah. Actually, I did my, speaking of, I did my oat panel, right? I said I did my cycle map, and with that, I did my organic acid, and it was perfect. In fact, it was
Awesome.
so perfect. I took a screenshot and sent it to the owner of the lab, Mark Newman. And I said, look, I'm perfect.
Look, I'm perfect.
I'm perfect. Not in hormones. My hormones are not perfect, but my dopamine and norepinephrine and serotonin markers, my B12, B6, those were all great. So I think.
Yeah, for the listeners, you need to follow Dr. Carrie Jones on Instagram. She's a hoot, and she posts some really good stuff.
Hey, thanks.
Yeah. Oh, I appreciate you, and I'm very grateful that you took the time to be with me today.
Yeah, I'm psyched that you reached out. Yeah. This is great.
A lot of people out there don't understand kind of what we do, and the Dutch test and the oats test are something that really help us as practitioners get to the root cause of issues. And this is a great test.
I would agree. Yeah. Test, don't guess.
Yeah.
But that goes for anything. Thyroid, iron, vitamin D, right? Like any marker you're curious.
Oh, yeah. I mean, I'm amazed at some of the blood work I see, and then on just a regular panel, there's so many things missing. Mm-hmm. And it's like, you're not even running GGT?
Right.
You know? I want to see GGT.
Right.
So,
yeah. I just had a practitioner, not to totally get sidetracked because we're at the end, but on the Dutch test, their glutathione marker was off, and then they ran a GGT, and the GGT was high. And I was like, what? They have a glutathione problem. There's a liver problem happening right now.
Yeah. There's a lot of things that aren't run on a normal panel anymore, but that's a whole nother rabbit hole.
I know. I hear you.
So, anyway, I appreciate you, and I'm grateful for you taking the time out, and thank you so much for being with me today.
Yeah, absolutely. Thank you. This has been fun.
Thank you for listening to today's episode of the Rebel Health Coach Podcast with Dr. Carrie Jones, today's guest. If you would like to have a Dutch test done on you, please feel free to reach out to me through the website at tomunderwood.net. That's Tom with an H, THOM Underwood.net, or email me at THOM@THOMunderwood.net. That's Tom with an H at TomUnderwood.net. And I can save you $100 off the price of a Dutch test complete. And I will be certainly glad to help you and help you read it also after you get the results back. Thank you and have a great day.